All right, joining us on the program to discuss the health sector as it affects the Nigerian Medical Association and the National Association of Resident Doctors. I'm being joined by the former president of the National Association of Resident Doctors, Dr. Afolabi Akinkunmi. Thank you for joining us.
Yeah, good afternoon.
All right, your colleagues are meeting with the federal government at this moment in time in Abuja. Tell us some of the issues that are being raised.
Okay, well, some of the issues include payment of salary shortfalls for some federal teaching hospitals and some state teaching hospitals, including LATEC Teaching Hospital Bumosho, LATEC Teaching Hospital Osogbo, failure of remittance of pension deductions for our members, and some other agreements, the enrollment of resident doctors in the IPPIS, Integrated Payment Payroll Information System, and some other collective bargaining we have had in the past.
All right. Now, the government has already given an assurance that the issues raised will be resolved in no time. But will this be enough to avert a strike that is billed for Monday next week?
Well, as we speak, members of the national executives are meeting presently in Abuja. And of course, we expect that there will be positive resolutions from that meeting. The truth of the matter is that we've had to bend over backwards severally, and the fact that the areas are accumulating in a lot of hospitals. Of course, like I've always said, sometimes it's difficult for us to take decisions to embark on strike action, but sometimes that remains the last option we are left with. Some of these agreements are there in the past. For example, enrollment into the IP system is something that we believe that it is feasible. And of course, it's also something that, of course, we block leakages in the system. And so we believe that with some more discussions, and especially when we still talk about actions, with more actions from agencies of the federal government, things will probably the strike can still be considered.
All right. Now, weighing the demands, really, what should come first for the present leadership of the Association of Resident Doctors? Is it the poor working conditions, the issue of poor working conditions, or payment of salaries?
Well, as you know, both will actually go hand in hand. Obviously, we know that the health sector is one sector that requires a lot of funding, and we want people to be also in good working conditions. You might recall that there have been several outbreaks in the country. Even recently, there was a Lassa fever outbreak, and in some places it's still there. And so health workers are involved in a lot of risk as per the nature of our jobs. And as such, also, we also demand good welfare. And we also know that the issue of medical tourism is there. And so we must ensure that we give adequate funding to the health sector such that we can reduce the stem or the tide of medical tourism, to ensure that our people get quality health care also here in the country. So both go hand in hand on good working conditions and also payment of salaries. And of course, you know that in some of the state teaching hospitals, they've not gotten salaries for some months now. And so we also expect that doctors there will be well looked into, and this issue of the salaries also will also be looked into.
All right, former president of the National Association of Resident Doctors, Dr. Afolabi Akinkunmi, thank you for your thoughts. We appreciate your time.